Welcome to Whispers in the Wind, stories of true crime.
I do.
Please have a seat in the witness chair. Mr. Anderson.
Can you please state your first and last name and spell your last name?
Brian Meyer, M-Y-E-R.
And how are you employed?
I am employed by Gruth Help Incorporated, which is the physician employment group for health partners.
And what's your position?
I am an acute care surgeon.
What kind of education and background do you have for your position as a surgeon?
Sure. So I went to medical school at Albany Medical College, completed my MD there, then went to Eastern Virginia Medical School for my surgical residency, which was 5 years. Then went to Shock Trauma, University of Maryland, for a surgical critical care fellowship. There is no actual fellowship for trauma per se. That's the training that you get for trauma. And then stayed and did a second year for acute care surgery fellowship at University of Maryland Shock Trauma as well.
And so is your position specifically a trauma surgeon, or do you do scheduled surgeries too?
I don't really do much in the way of elective surgery. I do surgical critical care, emergency general surgery, and trauma surgery.
Okay. And were you working on July 30th of 2022?
I was.
Where were you working?
At Regents Hospital.
And on that day, were you involved with the evaluation and or treatment of Ryhley Mattison, Dante, Carlson, and Alexander Martin?
Yes, sir.
Who was the first patient that was brought in?
That was Ryhley.
And what was Ryhley's condition when she got brought to the hospital?
Just to clarify, what do you, condition?
What was her injury?
So she had a wound, open wound to her abdomen. We'd call it a thoracoabdominal wound, so it's right between, close enough you can't tell if it's in the chest or in the abdomen, or both. And in her case, there was clear evisceration of the omentum or fatty apron that we have in our belly.
And was that exposed?
Yes.
And what was your response after you noted the injury?
So when you have penetrating trauma like this, you don't know what all is involved, and so this patient needs an exploration. And so we immediately called the OR to bring her upstairs and go proceed with that exploration.
What was the result of the exploration? Did she have internal injuries?
She did. Just for clarification, I took her to the OR as we were about ready to start the case was when I got notification of a second more critical patient. And so my chief resident started the case. As a level 1 trauma center, we have a backup surgeon that is always available. And so I called my backup partner to come in to complete that surgery. And so I did not do the surgery itself, but she ended up having 2 injuries to her stomach as well as an injury to her diaphragm.
And when you say injuries, to the stomach and diaphragm, can you just explain what you mean?
Sure. So with a penetrating injury like this, there was a full thickness injury to the stomach in 2 areas. So the stomach had a full hole in it, and then also there was an injury up in the diaphragm as well.
And she required emergency surgery?
She did.
What's the danger of a cut through your stomach?
Sure. So if your GI tract is meant to keep everything inside where it's supposed to be, and if that leaks out into your belly, you can get sick from that. Untreated, that would lead to sepsis and progress likely onto something like septic shock, where your blood pressure would get low and you could get an overwhelming infection. For the diaphragm injury, if you have an infection that then goes from your belly where it would otherwise be contained and moves up into the thoracic cavity, that can create its own extra issues. And long term, if you don't fix a diaphragm injury, you can get a hernia through that where the bowel or the spleen or anything in your belly that lives in that left upper quadrant can move up into that area, lose its blood supply, and then lead to another emergency surgery.
And did the hospital do blood work on Ryhley?
Yes,
What was her BAC?
0.09.
And you said that once after you did the evaluation of Ryhley, you got word that another more critical patient was incoming?
Correct.
And who was that?
That was AJ.
And what was AJ's condition when he arrived?
So AJ was critically ill. We received word that as he was being flown to us that his heart had stopped. And so based on the records from, we didn't have all these details at the time, but based on the EMS records from LifeLink, he went into PEA or pulseless electrical activity cardiac arrest for 9 minutes. They were able to get return of spontaneous circulation as he rolled down to our ED, and we quickly assessed him there.
The cardiac arrest for 9 minutes, does that mean his heart stopped for 9 minutes?
Correct.
Did his heart stop at all at the hospital?
It did. So he was only in our trauma bay and up into the OR within 5 minutes, and as we rolled to the operating room with him, his heart again stopped on the monitor as we were rolling him into the OR.
And did AJ require emergency blood transfusion?
He did. He received transfusions prior to his arrival, so LifeLink transfuses blood in their helicopter. And then we had activated what we call a massive transfusion protocol, or MTP, to have lots of blood products available and continue to infuse those upon his arrival to us.
Was he in shock when he arrived at the hospital?
Yes.
And when you use as a physician, when you use shock, what do you mean?
So shock is a condition where you don't perfuse your organs appropriately. So there's several causes of it. The most common cause of it in trauma and what AJ had was hemorrhagic shock, which is a subset of hypovolemic shock.
So when you use the word shock in medicine, it's a physical condition?
It is. It's a pathophysiologic condition.
And what can you describe what you had to do as far as surgery and what damage you found?
Sure. So when AJ arrived, he had a very large incision, essentially almost from his sternum down to the middle of his pelvis or his pubis. I had to extend this a centimeter or two just to make sure that we could get full exposure and see everything appropriately. And he had multiple injuries. The most important one, and the one that why his heart stopped and why he was so sick, was because he had injuries to his right common iliac artery and then also his left common iliac vein. So I repaired the artery. When I knew that there was a vascular injury, I'd called in Dr. Rosenthal, who's one of our vascular surgeons, and he ended up putting some stitches to repair the vein. We additionally found 3 injuries to his small intestine and an injury to his colon as well, the transverse colon.
And I think you said the iliac artery?
Yes.
Where's that located?
So the iliac artery is what supplies blood to your pelvis and each leg. So as you come down from the heart, your aorta splits down low in your belly, or as you go into the pelvis, into the common iliac artery. So there's a right and there's a left, and so it then continues on, provides blood, as I said, to the pelvis and the leg.
I just want to make sure I'm understanding. So each leg has a vein that comes up and meets somewhere?
So this would be up in the torso itself, not into the leg. So as it goes on, it then branches into an external and internal iliac artery. The external is what would continue on to go down into your femoral artery and then be the blood vessels that go down into your leg.
And where does that vein run through the torso or the stomach area?
I'd say it's about 2/3 of the way down in the abdominal cavity, where the aorta bifurcates or splits into 2.
Are there other major arteries and veins in the human torso?
Yes.
And can you just describe where those are?
So as I mentioned, the aorta would be the biggest one. It gives off branches to your mesenteric vessels as you come down through the abdomen, and then the big branches are the iliac arteries, and then into the external and internal. So this is a sizable artery, I would say, second only to really your in the belly at least, second only to your aorta.
Was AJ conscious for the surgery?
He was not. He had been intubated prior to his arrival.
And may I approach?
Yes.
Penny, it's been marked as Exhibit 29. What does that photo show?
So that is AJ. You can see he has a nasogastric tube in his nose, and below his gown you can see his abdomen exposed, and there's what we call an aphthera. So when someone is ill enough or has a reason why we would leave their belly open and not complete the surgery all in one setting, and in his case he was sick enough that that was the reason we did it, we put this special dressing on which has a vacuum in it and an area to protect the internal contents of the abdomen, and then leads to a nice closed system so that any fluid that is in the belly can drain out, and then in a delayed fashion we take patients back and re-explore them in the next day or two.
And did AJ require follow-up surgeries?
He did. He had multiple.
So the wound that's visible in that photo, I think you said you opened it up maybe another centimeter or two.
Correct. Both at the top and the bottom, it would have been a centimeter or two.
Okay. So other than that, that's the centimeter or two on the bottom, centimeter or two on top. That's the wound, the size of the wound you came in with?
Correct.
Judge, I'd move to publish 29, and I'm just going to hand it to the jury and put it on the screen.
Any objection to 29? All right, you may publish.
And was there a BAC taken of AJ?
There was not.
Would AJ have survived without medical intervention?
No.
You're a trauma surgeon. You deal with a lot of traumatic injuries. Does this case stand out to you?
It does.
You specifically remember the...
I do. I've not had a patient with that large of a penetrating wound previously.
And then Dante Carlson, how was he transported to the hospital?
He came via helicopter.
Was he given any medications on the helicopter?
He was.
Do you recall offhand what those were?
Fentanyl, and if I can look at the record here, I think it was ondansetron or Zofran.
What's fentanyl used for?
It is both used for pain as well as for sedation, depending on the clinical scenario.
Is it a narcotic?
Yes.
And what was Dante's injury?
So he actually ended up having nothing internal, but as I had said earlier, one of the issues with penetrating trauma is you don't know how deep anything goes and what is injured until you actually look at it. So in his case, it was early the next morning. We took him to the operating room, did a diagnostic laparoscopy, confirmed that there were no injuries beyond his abdominal wall. So his injury was a traumatic hernia that we repaired.
And why, if there's a penetrating injury in the torso or stomach, you said you got a, so did you use a camera or how did you?
Yes, so we used a camera, put air into the belly so that we have space to do it through little incisions, and then evaluated the intraperitoneal space to make sure there was nothing injured.
And you said you have to do that to make sure there's none of those vital organs or arteries or anything else damaged inside?
Correct. You need to make sure there's not something injured to your gastrointestinal tract that is leaking contents, or even if a blood vessel or your spleen is injured, it may not bleed significantly, but you may end up with injuries to it called pseudoaneurysms that can bleed in a delayed fashion.
And what was the Dante's blood drawn and tested for BAC?
It was
What was his BAC?
0.09.
I don't have anything else.
Mr. Strofficy?
Thank you. Good morning, Doctor.
Good morning.
I'm going to start with Ryhley, if I could.
Sure.
Okay. I'm going to start with this. You had mentioned that her blood was drawn and her alcohol concentration level was a 0.09. Is that right?
Correct.
Do you remember what time that was?
That would be obtained. I can look and find the minutes if you need that. It would be when she first arrives to the ED. We take blood from most patients and send it off as part of a rainbow draw that every lab that we get available, and then we send to the lab and select what we're going to choose.
Okay.
From there.
And you're free to look. I'm not here to trick you. If I told you that it was drawn at about 4:55, that makes sense?
That would sound about right.
Okay. And I don't want to interrupt you while you're looking. Do you recall on the records that you have what she weighed about?
I do not.
Okay. I think there's been testimony, I think 115 is what she had said. Is that kind of what
That
you
sounds
recall?
ballpark about correct.
So you would agree that if the draw's at 455, she's an 09 at 455, right?
Correct.
That doesn't mean that's what her alcohol concentration was when this incident happened. True?
I'm not a toxicologist, so I'm not gonna. I don't know that I have the expertise to get into specifics on that. But common sense would say yes.
Okay, so, and again, I'm not going to ask for your expert opinion on anything. What I'm going to ask you is, do you, whether it's personal experience, training and experience as a medical professional, you understand that alcohol absorbs and eliminates at different rates, right?
Correct.
Okay, so if this is alcohol, this water bottle, and I drink it, it's not fully absorbed into my body immediately, right?
Correct.
It would take some period of time to do that. Yes?
Correct.
Okay, so I'm assuming, well, tell me if you can answer this. Do you have any information that after she was injured, she was consuming any alcohol?
I do not.
Okay, so the blood draw is about an hour and change before the incident. Her alcohol concentration, based on what you know, based on your training and experience, is not an 09 at the time, likely, correct?
Most likely.
Okay. And I want to just make sure I have this right. You had said that if Ryhley's injuries were left untreated, sepsis, other types of infections, I don't want to discount what you're saying, I just tried to write as fast as I could. Other infections and a hernia, is that right?
Correct.
Okay. And can I approach you?
Yes.
So I'm going to talk to you about AJ for a minute.
Okay.
Okay. And you said that his injuries were kind of, is the belt line or a little bit lower than the belt line kind of?
No, higher than that.
Okay. So the belly button?
Below that.
Okay.
right between those
the belly
two.
button and the belt. All right. Can I ask you this? All of us here have seen the video of kind of what the injury to A.J. Martin looked like. Okay, I'm not saying you did. I'm just saying we all have. Okay. Can the trajectory of the injury, meaning what it ends up looking like, change based upon what the person who's being injured does? Do you understand my question?
Well, sure. I mean, penetrating trauma is all about what the trajectory of of the object doing the injuring does, and our job is to figure out what that trajectory is. So if someone moves as the penetrating object is going through them, that would change the trajectory and what the injuries would be.
Right, fair enough. So if, for example, I stabbed you, and when I stabbed you, you were shoving me and actually knocking me backwards off my feet, okay? That could change, like, my arm angle and what ends up happening to you as a result of that. Is that fair?
It's a dynamic process, so the two would be affecting each other for sure.
Sure. So something that looks like a stab wound that's going straight, right, that's kind of going in, that might not certainly have the same impact of taking an injury from your navel area up to your chest area as it would be if that same penetrating wound happened and the person got shoved and the knife got moved. Is that fair?
It would, although I would worry at AJ he would have had a worse injury if it went deeper and it didn't go up.
Okay. Can you say that again for me?
So you're saying if the force is that someone gets pushed and instead of the knife going straight, it comes up. In his case, that would have actually been a better thing because his deepest injury was that lowest part. And if that knife went deeper, it would have had a bigger injury and he probably would have never made it to the hospital.
Okay. But in terms of what, the jury has seen this photo of his abdomen area. I guess I just want to make sure that I understand. For example, Ryhley suffered a puncture, if that's fair, a puncture wound. Her abdomen or her side here didn't open up like that, right?
It was wide open. It just wasn't as large.
Right, understood. And that could be, meaning what it looks like, I think you said this, could be based upon what the person's body is doing when the injury is occurring. Is that fair?
Generally, yes.
Okay. And does it also change in terms of the possible penetration of the wound? If I'm standing still and you stab me, okay, versus if I'm running at you and then you stab me? Could that have an impact on the force used in the depth of the wound?
It could.
And it seems logical to me, but you tell me if this is right. If I'm running at you and I'm a grown person and I'm running at you with some force, it certainly is possible that the wound could go deeper because of the force that I'm providing. Is that fair?
Sure.
Okay. Was it, it's not a criticism, it's a question. A.J. Martin's, because of the transfusions, his blood couldn't be tested for alcohol. Is that fair?
No, the reason we did not hang around long enough to get blood specimens in the trauma bay.
Okay.
We moved so quickly to the OR that he did not get the normal labs drawn in the ED. And our anesthesia team who takes over the resuscitation in the operating room, that wouldn't be part of the order set that they would send off because it wouldn't have affected his care.
Okay, very good, thank you. And Dante Carlson, just the same, he has a test result of an 09, but that's also at a later time, right?
Correct.
Okay, so it certainly may not be what his test result was at the time of the incident, true?
It may not be what his level was at the time of the instance, yes.
Right, okay. And I think this is fair, and you tell me, what you ended up doing for Dante Carlson was repairing a hernia, Is that fair?
Correct.
Okay. That's all I have. Thank you.
Mr. Anderson, do you have more questions?
As far as what people's movements contributed, you don't know, you can speculate or say it could affect it, but is that the extent of what you're able to say?
Correct. I mean, physics is physics, and it's a very dynamic thing, and movement of two objects that are interacting is going to lead to different outcomes.
I don't have anything else.
Mr. Shroffisy? All right. Thank you, Dr. Meyer. You may step down.
Thank you for joining me here at Whispers in the Wind. If you enjoy this channel, please like, share, and subscribe.